So the way I do brow lift surgery, there's two approaches. One is an endoscopic approach. Through this approach, we make 3 small incisions just at the hairline. They're vertical incisions. And through these incisions, with the scope, we lift up the skin and soft tissues off of the forehead. Then we advance the skin up and out, so it doesn't give you a surprised look. I think most people are very afraid of brow lifts because they're afraid of having that typical, very unesthetic, surprised look that you see in some Hollywood stars. This can be totally avoided if it's done conservatively and in the right amount of resection. We fix the skin in the superior position with what we call Endotyne device. It's a dissolving, almost like a carpet tack. It holds the frontal scalp up until it's healed, and then it dissolves. It's a very slick device. The nicest thing about it is it's very predictable, and you can adjust it to match both brows so they look exactly the same. The procedure takes about an hour to do. There are a couple sutures placed in the scalp. I do put a drain in, and that usually stays in 24 hours. I like to see people back the next day, make sure there's no complications, usually a week later. There's very little discomfort. Occasionally people will complain of a headache, but once the drain comes out, that usually resolves. About a week for recovery, sometimes 2. Minimal bruising. If there is any, it can be covered up with makeup. It's a very popular procedure with both men and women. The other option for a brow lift is what we call a subcutaneous brow lift. It's a little bit less involved. The advantage of doing it the endoscopic approach is that we can get rid of the frown lines or the 11s. With the subcutaneous approach, we cannot do that. The subcutaneous approach is a little bit less expensive, a little bit less involved, a little bit less recovery. And what's involved with that is an incision in the lateral aspect of the hairline, and we lift up the skin and just advance the skin on the lateral aspect or the outside of the eyelid, so it gives you a nice rounded arched brow in an upper and outer direction. The recovery from this is extremely simple. There's virtually no pain with it, no drains, dissolving sutures except for 2. And again, it's another week or 2 for recovery after a subcutaneous brow lift.